So today's patient we have on the table here presents with a real common condition in our office, sciatica. This patient has sciatica that runs from the lower back through the buttocks cheek on the left and down the leg, and it's unrelenting sciatica. Two main causes of sciatica can be from a herniated disc in the lower back of the lumbar spine, but the majority of causes of sciatica come from pelvic misalignment. In Bill's case here, we have an issue where the sacroiliac joint is out on the left side. His sacrum's deviated over to the left. It's bunching up his piriformis muscle, which is grabbing the sciatic nerve and starting to send the pain down the leg like this. So as a chiropractic technique, we're going to center his pelvis and get the pressure off that sciatic nerve by adjusting his sacroiliac joint and straightening out his sacrum. The first thing I want to do is increase the circulation in the area a little bit, so we're going to do a little vibrational massage right across the sacroiliac joint. We get the blood flowing, and we do that for a little bit. And then I'll move up into the lumbars. Just put a little pressure there. And then we'll come down and off the sacroiliac joint and dig into the piriformis muscle with a little bit more of a firm pressure into the muscle, trying to get it to loosen up its grip on the nerve. And usually, most people like this part the best because it feels good. You know, a massage, everybody likes a good massage. So it's just that this is a vibrational massage, so it's actually shaking things up a bit, and then I can put the pressure into the muscle by pressing downward. So it's just enough to get the blood flowing and loosen up a little bit. So what we're going to do now is we're going to use a drop table technique, also called like a Thompson technique, where we're going to raise this piece up on the table and we're going to apply some pressure right on the sacroiliac joint like this. And when I press down, the piece is going to drop. It's going to use momentum. My force is going to go through the joint as the piece drops, and that's what centers the pelvis. Now the table makes noise when we do this, but the patient doesn't really feel it. They just feel my arm on there when I go down like that. Sometimes you hear the noise and you think, oh my God, what are they doing to that poor person? But as you can tell, this patient is not screaming or yelling. So we're centering that sacroiliac joint. And now we're going to push the sacrum inward. So we're going to get on that with my forearm. I use my forearm, this way I can cover the whole side of the sacrum as just opposed to a piece of it. And then we're going to push down like that. We're going to push that sacrum across to the midline. Good. And then we're going to do it one more time. Good. Now we're going to take out an instrument. This is called the ArthroStim. It's a joint stimulator. It's going to deliver a quick, rapid thump into the joint. So we're going to push down the sacroiliac joint like this. And then we're going to go across the sacrum here. Again, sort of doing the same thing I did with the drop table, only now we're using the instrument. Now, in other patients, this patient has other complicating issues. There's disc degeneration and disc herniation down here. So if that wasn't there, we'd probably put the patient on their side and do a spinal manipulation of that joint. We would adjust that sacroiliac joint by hand, where that would be one of those adjustments where you would get that audible release and hear that popping noise. And as that happens, that usually feels good. But we're able to do the same thing by using the drop pieces on the table. Now we're just going to change our attachment and just work up his spine a little bit. The thing with discs is that you don't want to put torque on the discs because it can make the problem worse, which means twisting. Torque is twisting, so we don't want to do any twisting. So that's why he doesn't get that side posture type adjustment. But we can apply a little pressure with our hands like this. Good. All right. So that's pretty much what we would do for sciatica with symptoms going down the leg. We want to straighten out that sacroiliac joint, check for sacral laterality, and relax that piriformis muscle, which takes the pressure off the nerve, and then corrects the condition. Okay?